Turner with Simply Redefining Wellness and Counseling. You just saw my face the other day, but we are back and we are back with an amazing guest, Dr. Taska Moore. Uh, for about 18 years, she has cared for women, especially underserved communities, working for people of limited means, um, people who are presented with challenges, including battling diseases that are caused or worsened by socioeconomic disparities. Her career in medicine is expansive. She has experience in the areas of academics, community medicine, research, and utilization, resulting in well balanced perspective on medical issues. She spends her leisure time exploring and expanding her creativity through enjoyment of the arts, outdoor activities with loved ones, spiritual enrichment events for women, and writing. She believes this fosters her ability to think outside the box, devising innovative solutions when encountering socioeconomic challenges and other limitations in the body of medicine while caring for minority populations. She lives by the motto that if you help one person, you can change the entire family, which can then change a community, which of course we believe as well. And so we're honored to welcome her today. Hi.
Hi.
Welcome, welcome, welcome.
Thank you so very much. It is a pleasure to be here with you today. I'm thankful for everyone who's taken the time to join us as well. Thank you for having me, and thank you for that beautiful intro.
Thank you for being here. I am literally so honored when we thought about doing this series. You were literally one of the first people that I thought about. And
Oh,
Trista was
I
on a couple.
appreciate that.
No, seriously, because being a Black woman, right? Being an OBGYN, serving our communities, advocating for women's rights, like listening. So we're going to talk about it later, but Tasca has many, many educational resources on the Healthy Bum Club. There are videos on YouTube, and just watching those videos for me, myself, with the various experiences that I have had, and unfortunately, some traumatic birth experiences that I've had, watching those videos and recognizing how important this information is for us to have access to this information, right? For us to be talking about these issues is so important. And so I appreciate you. I admire you.
Oh, thank you for sharing that. I appreciate that. And it's Healthy Bum Club is such a passion for us. And I love the fact that it's a group of like minded women in all aspects of healthcare, bringing our unique perspectives, not just from a medical perspective, though we have the expertise to do so, but also because we're patients just the same and oftentimes with very similar experiences. So, when we have these critical conversations, as we are about to today. So I'm so excited about today's topic because it's so important to our community in particular. But we're coming from a perspective that's very personal to us, and we're able to marry both our personal experiences and then also the science behind it. So thank you for sharing that. It really helps us to know that we're making a difference in this space.
Yes, absolutely. I have so many friends that are misinformed, right? I feel like with my first pregnancy at the age of 35, I was a bit misinformed. I didn't know enough. And even beyond that, educating myself, I still didn't know enough. So to learn that there are providers that want us to know our rights, want us to advocate for ourselves, will walk alongside us in advocacy is life changing, to say the least.
Yeah, that's wonderful to hear, and it really should be the norm, right? It should be the norm that as healthcare providers, also sometimes termed healers, it's about walking with the person through their health journeys.
Yes.
And my patients make me a better doctor.
Mhm.
I love the fact that we have such really good relationships that we're able to have very practical conversations. They tell me when they don't like what I'm doing. and I don't take it personal. They tell me when I'm doing good and when I can improve things and how to improve things for other moms. And I really love the fact that they feel that they can be actively involved, not just in their own healthcare, but in making me a better physician so that I can be better for the next person also. So I'm a
Mm,
product of my patients.
that's amazing. That is so refreshing to hear, and I think you're a blessing to them by teaching them what to expect from others, right? If we're accustomed to not participating in our own healthcare and we encounter a provider like you who is willing to like let us ask the questions and answer our questions. And I know we were talking previously, like spend
Mhm.
the time needed, you know, not rush through an appointment. When we encounter someone like that, when we go to the next person, we either know, this is not the person for me, or we know
Mhm.
we can advocate for ourselves and say, I need more time. My questions weren't answered, or that pain is being ignored. Like I told you that I have a pain and you're not taking it seriously. Right. And so
Right.
it gives us the strength and the ability to advocate for ourselves and recognize what true care is.
Right. It's we term it advocating, but it's really just knowing that we deserve good care, right? And it's hard to really wrap your brain around the fact that you have to advocate to get what is rightfully due to every single human being on this planet Earth.
Yeah.
But you're right, advocating is hugely important. I've had to do it for myself as a patient as well. So I practice what I preach, and I also live what I preach,
Mm.
so to speak. So I have had, even as a clinician, I've had to advocate for my own health. And
Wow.
as unfortunately some of us know, being quote unquote more formally educated does not excuse you or exclude you from some of the outcomes that we see. We
Yeah.
know that, in fact, for Black women being more formally educated, I use the word formally educated because some bomb folks that didn't go to college, didn't go to high school, but they can school me on several things, right?
Mm.
So these particular studies looked at formal education, going to a college, having a career, having a degree, and found that there's a 5 times increase in maternal mortality for Black women, which is really mind blowing. And we kind of know some of the famous stories, like the Serena Williams, who have spoken out about their experiences. So we are not excluded from having these experiences. So I have to also share with my patients what I've learned that works for me.
Mm.
I've gotten to the point where I like my healthcare team,
Mm.
including dental. We don't talk about dental, but dental experiences very similar too, right?
Yes.
And so many of us have very traumatic dental experiences,
And as
especially when
well,
we talk.
right? If
Say that.
we experience something traumatic, pain, and we are taught that that's the norm, right? You go into the dentist, it's just gonna hurt, you just gotta bear it, they're gonna give you the meds, but then you don't go for a year or 2 years or 5 years or 10 years, and then all kinds of issues are going on. Currently, I go to a dentist where I never feel any pain, and I remember an experience when I was a child that we didn't have a choice, but it made me afraid of dentists. And now that I'm an adult, I tell everyone to go to this dentist because the experience that I've had before is nothing compared to this.
And it's as we expose these areas, it's really mind-blowing how our lives are built with all of these disparities. But
Yes.
I connect with you on that. I had a traumatic experience as a child, and that lived with me for all of my dental experiences.
Mm.
And so the first thing I said to a new dentist I went to was, I don't like y'all. Like, I don't like the experience I have with you guys. I have pain every time. And even in my adulthood, I had a dental procedure where my pain was not believed, and I had to bear and endure the pain. And from that, even to this day, I sometimes remember that pain and anticipate that pain, even though it's no longer there when they are in that particular arena. So it spans every aspect of our lives, right? And like you, I found a dentist that I liked, and I actually told him, I'm here because I don't like not being heard, not being believed.
Wow.
And my friend, just like you are doing, referred me to him. And I said, okay, I finally feel safe.
Mm.
I finally feel safe. And I remember the first time he took care of me, I literally almost brought tears to my eyes because I kept thinking, wow, like you can have dental care and not be in pain
Yes.
and not being told that you are the source of the problem when you know you're doing what you're supposed to be doing. So it's mind blowing how these experiences transcend just about every aspect of our life. Women's health is no different.
Yes, it's so true. As you say that, it brings to mind. So I interviewed our midwife for our third child, Takia Ballard, on
Hmm.
Thursday. And at my first visit, I'm there because I'm pregnant. You're going to provide care for my pregnancy, right? And we talked, we chatted, we laughed. And then when it came time for the exam, I get on the table and she said, "Do I have permission to check you?"
Hmm.
Never in my life, Taska. Not a OBGYN, not during any of my births, not during any of my hospital stays. I had brain surgery when no one has ever said, "Do I have permission to touch you?" Can you
Wow.
imagine? And I
Wow.
said to her, like, "I'm here so that you can touch me." And she's like, "But it's still your right to say yes."
Right.
I need to ask every time, every visit. She asks every visit. Close relationship, laughing, talking. She's like family, and still every visit she
Hmm.
asks my permission. That's that changes the trajectory of how you receive healthcare.
Yes, and how empowering is that, right? And it's really about women always feeling like they're in control. So I ask patients, do you want to insert the speculum or do you want me to insert the speculum? Things like it's the simple things that make a person feel safe and comfortable and knowing, and that transcends and taking that experience, someone can then take it to relationships, right? Knowing that when I'm dating someone, or when I'm going out with someone or when I'm in a relationship with someone, I still deserve the respect of being required to give my consent.
Yes,
And simple things like that really teaches women and shows women how they are to be treated, because oftentimes we enter the offices and there's a history that comes before us, and
yes,
sometimes that history includes abuse and trauma, and we have to relearn what's normal.
yes,
And so I love that you had that experience with her. But yes, it's very important that patients feel comfortable and are giving their consent.
yes, absolutely. Tasca, I know we can talk about 9 million things today.
Yes, we can.
And so, for everyone that's viewing or will view this in the future, our prior lives, we kind of focus on. Let me give you a bit of information on how our guest expert could be beneficial to you um, prenatal, during pregnancy, postpartum, uh, and really focus on just in general helpful tips for the pregnancy. Today, we're going to be doing it a little bit differently. And it's funny because with every live, we've kind of touched on the importance of therapy. We've kind of touched on the importance of mental health, but we haven't dived into it. And so today, Taska and I are going to dive, right? I know we had said we were going to talk about like mood disorders, postpartum depression, postpartum anxiety, which is not often spoken about, and some other things. And so
Mhm.
just share with us, what are some mood disorders that you might experience during pregnancy?
So during pregnancy, patients oftentimes will experience what we call peripartum. I know oftentimes we use the word postpartum, but we really want to make sure that patients are informed that these mood disorders can occur at any point during the pregnancy and after the pregnancy, not just in the stereotypical 6 weeks, 6 to 8 weeks postpartum period, but up to a year, and some patients even beyond years may have continued experiences related to their child mood disorder experiences related to their childbirth experience. So you have patients who more commonly may experience peripartum depression. 1 in 7 women may experience that. Less spoken of, as you alluded to, is peripartum anxiety. Up to 1 in 5 women report having anxiety disorders during pregnancy, and that can come in a variety of ways, from your social anxiety experiences to your OCD experiences. And then you have women who actually, less commonly, we don't talk about post-traumatic stress disorders, but women who in previous pregnancies or may have some type of sexual violence history that can be triggered as a result of being pregnant, or giving birth. And so these are the more common things that we can experience. Less commonly, but equally important, are your peripartum psychosis. So patients who have their first psychotic break, and about 45% of those will actually be the initial onset of bipolar disorder. And others will have the experience of just a isolated psychosis related to childbirth, that's triggered by childbirth.
So let me just clarify. This so this can happen during your pregnancy, not just after your pregnancy.
Absolutely, absolutely. And one of the really key things to know is to really prepare, right? So we prepare for pregnancy in so many ways. We take that folic acid at least a month before getting pregnant. We're ready with our bodies. We're exercising. We're preparing in so many ways. We're getting the rooms ready, getting all the material goods that we need. But we often don't spend time preparing for our mental health, right? Because we don't really talk about it as much. Oftentimes, because mental health disorders are still associated with some level of shame and stigma in the society. So people are less likely to disclose, even to their practitioners and even to their loved ones.
Yes.
One of the most important thing to do is assess and know, what are my risk factors for having a mental health disorder? Well, certainly if you've experienced any type of mental health disorder in the past, you're more likely to have recurrence during the pregnancy. If you have a family member, this is why it's so important that when we gather for those holidays, and we have those holiday dinner, and we're talking about everybody's love life, what you're doing, what your career is doing.
Yes.
It's so important for us to have conversations about health, because a lot of times people don't know what people are experiencing in their families.
Yes.
But if my family member has a history of a mental health disorder, I'm more likely to have that experience as well. And for people who are in positions where, one of the things that I prioritize asking women with their first initial visit is, how do you feel about the pregnancy? We know that a lot of pregnancies are unplanned pregnancies. We can't assume that everyone's happy about being pregnant, right? So sometimes having certain life events, losing a job, divorce, but also getting pregnant, can be a trigger for mental health disorder, especially if it's an unplanned pregnancy, and sometimes maybe even leading to um, questions about parenting, questions about being a parent and the timing. All these stressors can be a trigger for someone.
Yes.
And then not having the social support, having relationship issues. If you're pregnant and you're in that season when you and your partner may not be having a good relationship in that particular season, that can also increase someone's risk factor for having these symptoms. On the postpartum end, having a baby that has unique health issues, being separated from your baby. So moms who have NICU babies are more likely to have these experience unexpected outcomes. Preterm births can be a trigger. Babies that are a little bit more cranky, a little bit more irritable, harder to calm down, can be a trigger for mom, because she's getting less sleep. She's more likely to be frustrated, exhausted,
Mhm.
and not having support after delivery can. And certainly new moms are more likely to have mental health disorders.
Yes. Okay, so you just touched on so much, and let me just clarify. Are you saying that everyone who's watching, I'm asking this question this way, even though I know the answer. Are you saying that someone could experience mental health issues even if it wasn't their mother or father that had mental health issues? Like if an aunt or an uncle or grandparent had mental health issues?
Yes. Yes, it does not have to be a first degree relative. And it's important for us to know those histories, right? And for us to release the stigma in our own families, make those conversations comfortable. If I'm in a family setting where it's comfortable and it's like talking like talking about diabetes and talk about hypertension is the same as talking about my mental health disorder, then I'm less likely to feel stigmatized and will more likely to disclose those symptoms to my practitioner.
Yeah.
Um, and it's important to know what it looks like, right? So oftentimes when we think of, for example, peripartum depression or just depression in general, we have this idea sometimes that the person may just be sad all the time, crying all the time, and we don't quite know the full spectrum of symptoms that may be examples of depression. So oftentimes, especially for women of color, because Black women specifically, we deal with emotional stressors in ways that are not well understood. And so sometimes our response may be that I feel more irritable. I may be stereotyped as being aggressive or angry.
Yeah.
And no one takes the time to really explore those emotions to discover the fact that it's really depression being expressed in that way.
Yeah.
Symptoms of isolation, someone who used to be more active, very social, and they just want to stay home. I just don't want to go outside anymore. I just want to be at home. I'm really tired. I'm exhausted. These are all symptoms of depression. I can't really, I'm just having a hard time concentrating at work. I don't know what's going on. Concentration is a symptom of depression.
Mhm.
Of our appetite changes, and people usually think of more emotional eating, but the opposite can happen. Someone who's not eating as much, losing weight, can be symptoms of depression. So it's really important for us to know what depression looks like and not just have just one or two symptoms in mind, but really having the gamut and being so in tuned and self-aware that we're able to see, wait a minute, I haven't been going out much. I'm having problems concentrating. Maybe I should get some help. And
Yeah.
similarly, having family members or loved ones who are informed and are able to see these symptoms. And if we have a history of depression, one of the important thing, one of our mental health providers used to say it all the time. So I'm going to echo her because I love when she says it. It's also having a safety plan for pregnancy. If you know you're at risk, then what is your plan? Does someone know, or is someone involved where they can know that they are your safe person? You can go to that person and share, hey, I'm having a little bit of struggles. I can't, I don't feel like I can reach out to my provider right now. Can you intervene for me? You know, having that person that is aware that you are at risk and you can feel safe with that person. It can be a partner, it can be a parent, it can be a best friend. Just having some type of plan, knowing the symptoms and having self-aware, also relating the symptoms to that person, because a lot of times our symptoms in a prior experience may repeat again. So if
Yeah.
you know in a prior experience you were more likely to be isolated, you were more likely to be amotivational, sharing that with that person so that they know to look out for those symptoms as well. And
Yeah.
also having the numbers and the resources available at your fingertip, keeping them on your phone, having a conversation with your provider at the beginning of the pregnancy. If I were to go down this road, what would I want the plan to be? When things are a little bit more clear in your head,
Yeah.
where you can come up with a plan as to how you want to be treated during the pregnancy.
I appreciate that you're so informed about this because I personally experienced depression, postpartum depression after my first. I had an unexpected C-section. I was unable to breastfeed, and just the cascade of things deeply impacted me. And I didn't know what that was. I did not know
Mhm.
I was depressed. And it took a very close friend pointing it out to me and saying, like, you're taking care of your baby and you're taking care of your husband, but then you're not doing anything else. You're not getting up off the couch. You're not really answering your phone. You're not really going outside. We need to get you some help. And I had no idea. And when I experienced slight postpartum depression, it wasn't as extreme with my second, I was able to recognize it. And I had a
Mm.
close friend saying, like, did you go outside and get some sun today? Did you go
Mhm.
for a walk? Are you talking to your husband? Are you asking for what you need? Like, are you getting the support that you need? Right. But my practitioners, they didn't say anything to me. It was with my first, check the scar looks good, send me home. Never saw them again. Second birth, that practitioner didn't even check in with me and joked to my husband later that she should have checked on me. And I'm like, and she knew my history. I had told her that I experienced postpartum depression the first time. So even this, to have a provider that is like well versed and willing to say like, let's create an action plan. Let's have an action plan. You should be asking for an action plan is so important. Uh,
Mhm.
you mentioned depression, right? So what is the difference between having baby blues versus like a diagnosis of depression?
So baby blues may is very common. That's one thing we should know. So having baby blues is experienced up to 70% of women may experience baby blues. And it usually occurs within the first few hours after birth and can last up until 2 weeks after birth.
Okay.
Usually those symptoms are a lot more mild and they look and mirror very much depression symptoms also. You may have crying episodes, you may have some irritability, some fatigue, exhaustion. Those are more common symptoms for baby blues. When we're talking about postpartum depression, we're talking about one more persistent symptom and more severe symptoms, kind of like the symptoms I just described previously. So
Mhm.
having multiple of those depression symptoms and having prolonged symptoms, having more severity of the symptoms is more along the lines of postpartum depression or peripartum depression. Um, One of the things that you mentioned that I thought was is really key to talk about, which we don't talk about as often, is the breastfeeding aspect of it also, right? And so one thing, actually, before I even go into the breastfeeding, first let's touch about the practitioners and what the expectation is. So the American College of OBGYN advocates for practitioners actively screening for mood disorders. So in our setting, we screen every trimester, including the fourth trimester. And we use screening tools that are very accessible online. So I'm not saying for you to diagnose yourself because we are not going to have Dr. Google diagnose us, right?
Yeah.
But I think that there are, if you feel like you're in a clinical setting where you don't have the access to information, and we know that Black women in particular are less likely to receive access to mental health services. Go ahead and Google PHQ-9. Go ahead and Google the GAD-7, and you can take those screening tools online and take your results to your practitioner and go here. If you
Yeah.
don't feel heard, take your own score, do your own screening, and take it in
Yes.
to them, to their office, and say, what do we do about this? You know, and those are exactly what we use in the office. They're not diagnostic tools, and that's important to know. They're screening tools. And so once we get a screening tool, we then assess the patient, talk to the patient to really get a sense as to whether or not we're truly dealing with depression symptoms or sometimes symptoms of motherhood. Exhaustion is very real in motherhood,
Yeah.
and not every exhausted
Sleep
mom is going to
deprivation.
be depressed.
Yeah.
Say that again.
Deprivation.
Yes. And we know that sleep deprivation is both a trigger and a sign, right? So a sign of depression is sleep dysfunction, but sleep dysfunction and lack of sleep and exhaustion
Yeah.
is also a trigger for mood disorders. And matter of fact, in some countries they use sleep deprivation as a form of torture. And it was interesting for me to read that. And I think they use, like, they wake people up every I'm not going to mention the country, but they wake the people up every 2 to 3 hours. I was like, wait a minute, that
That
sounds
sounds
very
like motherhood.
familiar.
Yeah, sounds like motherhood.
Yes, a newborn is waking up every 2 to 3 hours typically.
Mhm.
So if it's used as a form of torture, that really tells you how much of an impact it has on the mind.
Yes.
And also, just even that sudden hormonal change after you give birth is going to lead to certain symptoms. We know that the metabolite for progesterone, one of the main hormones for pregnancy, interacts with the brain, right? We know that it's causes certain changes in our mood. So that's very known. So we know that there is a correlation between our hormonal change and the way our brain function and works. So you are not crazy. Like this term, like, I don't want to be seen as crazy. You're not going to lose your babies. Mental health disorder is not a reason to separate a mom from her child. I'm going to say that again. Mental health disorder is not a reason to separate a mom from her child. You're actually going to make it worse. And mom should not feel fearful of that, and and that should not be a barrier for people receiving the help that they need.
Absolutely.
So definitely, recognizing these symptoms, know what to look for, making the safety plan really, really important. And then on the breastfeeding arm of it, breastfeeding does two things. So one of the things I do want to share to mom, there's, we want to make moms feel like we have all these options as to how we want to be a mom. But we also don't want to push moms to feel pressured to be a certain type of mom. And oftentimes, breastfeeding is one of those topics where moms feel pressured to yield to or meet a certain standard as a breastfeeding mom. I'm not directly breastfeeding, I'm pumping and giving breast milk, or I'm breastfeeding as a supplement and not primary, or I chose not to breastfeeding, so I feel shameful.
Yeah.
If breastfeeding is a trigger for your mental health, because breastfeeding is hard, it is very hard. And
You have to
kudos to the
learn how to
moms.
you have to learn
Yes.
into it. People speak as if you're just gonna know what to do and your body is just gonna flow, and that's not always true. And unfortunately, because of trauma within our community and intergenerational trauma that has passed down for many generations, it is not always easy, and then we have not seen it as an example to us. I don't remember ever seeing anyone breastfeeding when I was 2 years old, 3 years old, 5-year old. I bottles. All the baby dolls had bottles, all the moms had bottles.
Mhm.
I had no idea, and for me, it was difficult. All 3 of my children had tongue ties, and actually multiple like, lip ties, tongue ties, and other ties.
Mhm. Mhm.
If I had not gotten help, I had a lactation consultant who was knowledgeable. I saw a
Mhm.
lactation consultant in the hospital that was knowledgeable. If someone hadn't said it to me, get it checked out, and then continued with support, I
Yes.
I wasn't able to breastfeed my first, but then my second and my third breastfed into their 2 and 3.
Wow, that's amazing. That's
Mhm.
amazing. But it's such a steep learning curve, right? And it's a learning curve because two people learning at the same time. And don't assume, as you mentioned, your experience with one child may be different than the other. You're dealing with a completely different human being, right? Different personality,
Even
different.
even for us,
Yes.
with my first, it was my first, I was
Mhm.
35, there was a lot that I didn't know, and even though with my second, I was 38, I knew a little bit more, but I still didn't know enough. The
Mhm.
same thing with my last one, I was almost 43, and it was a learning experience each time, and you go into parenthood thinking, "Well, I've done this before." You haven't done it before at that time of your life with that
Yes.
child.
Yes, with the circumstances that you're living with. Because now as a repeat mom, you have now sometimes a toddler, an infant, a child that's also dependent on you in addition to your partner, in addition to this newborn. So these dynamics, we have to be so much more flexible and give ourselves so much more grace.
Yeah,
So if your mental health is being challenged by trying to meet the expectations of breastfeeding, then breastfeeding may not be the right thing for you. And it's okay to release yourself of the guilt of feeling like you didn't meet a certain standard, because choosing your mental health helps your baby more than not choosing your mental health,
yeah,
including with choosing whether or not to breastfeed. So it's so important that we give ourselves grace each pregnancy to make a different decision. Sometimes one pregnancy you'll solely breastfeed, another one you may do a combination of the two, and another one you may solely do formula. It's
yeah,
okay. Your
yeah,
baby's being taken care of, and it's so much more important to make sure you're managing your mental health, because we know, and I'll talk about perinatal programming in a little bit, the impact of untreated mental health disorders on the child. And there are outcomes related to the child, which is why it's so important for us to have this conversation. But then on the other hand, also, we want to also make moms aware of the fact that breastfeeding actually also helps your mental health. And so having that bonding oxytocin hormone released, having that loving prolactin hormone released during breastfeeding actually helps with your mental health. And Sushana, you had mentioned a couple other things: socializing, having a social support. Women who are more likely to have mom groups or be a part of mom groups tend to do better. Women who are have support from their spouse tend to do better. Women who are able to have that time at home and not have to go back immediately to work, which is something that uniquely impact women of color, not being able to have access to paid time off as other as white women, for example, impacts our mental health. So having access to employment that supports you as a mom is important, and making sure that you have people. I will say, when people ask, "What do you want for your baby shower, or for preparing for having a child?" Before we get to the diapers and the wipes, and those are very important because they're expensive, let's also recruit people that you trust that won't affect your child. Make sure they're, assess them, make sure they're healthy,
Exactly.
that you trust with your child, that you can say, okay, can you give me the ability to call on you at least once in the next 3 weeks to come over and watch my child for maybe 4 hours so I can take a nap? Can you watch my child so I can run an errand? Can you watch my child so I can take a shower?
I was about to say that.
So, like utilizing your support system, and don't be afraid to utilize it is not a shame. You are not, you don't have to be a superwoman, and you are a superwoman regardless, by the way. But
Yeah,
being a superwoman doesn't mean that you do everything. Being a superwoman sometimes means you're strategic.
yeah.
And you know when it's time to delegate, okay? And delegate to your family members, your loved ones, they want to help you.
Which is part of the difficulty, right? Because as Black women, we're often encouraged to do it all. We're often said to be the strong Black woman, right? And we watched our mothers and our grandmothers seemingly do it all. And we didn't talk about mental health. We didn't talk about the struggles. We didn't talk about the difficulties. My girlfriends and I always kind of joke like, y'all didn't tell us marriage was hard. Y'all didn't like obviously you fussed at us, but you didn't tell us parenthood was hard. You didn't talk about the challenges that you might face, right? And so
Right.
those things and the stressfulness of everything then impacts your mental health. And I wanted to take it back to a couple things that you said.
Hmm.
You talked about, the possible assessments that you could go online and find the PHQ-9. Once you do that, it's important to talk to your healthcare provider, if it's your OBGYN, your midwife, what have you. But then
Hmm.
also find support, right? Find a licensed counselor who can then also walk you through this time. It may be
Hmm.
3 to 4 months of counseling, it may be longer, right? In that time of saying, I had a child, you may unearth some family trauma that you need to address and deal with in order to be able to give your all to your family, to your child, to your spouse, to your partner. Um, and then that goes for breastfeeding as well. Finding support, having an internationally board certified lactation consultant, whether you're consulting with them via Zoom, because we know the day and age that we live in, or
Hmm.
having them come to your home or going to meetings. A lot of times hospitals offer breastfeeding classes, and we don't know that these classes are available, or we don't know that they're free or very low cost. And then we don't take advantage of these
Right.
opportunities, right? And so, on both sides, whether you're paying attention to your mental health or paying attention to some other areas like breastfeeding that you may need support in, find the support, seek out the support. If you want to use Google to research and find some people that will support you in that way. And then, like you said, tapping into your community. We always say it takes a village, but are you tapping into your village? Are you asking your village for the help that you need? Are you confiding in trusted people? Oftentimes we see the wedding party or the people that threw the baby shower. Well, are those the people that you can say, hey, I need a warm meal, right?
Listen, Sushana, you are stepping on some toes, but you are talking truth.
Can you make me a casserole? Can you come over and watch this baby?
Listen,
And it's funny because people, oh my goodness, I could just steal the baby. I'm like, 2 a.m. I need you to steal the baby at 2 a.m. I need you to
I need you to really do that. You are right. Yeah. Oh man, you stepped on some toes with really being mindful about who you're choosing to be in your party. Okay. Making sure that it's just not for the camera.
Mhm.
but it's for life.
Yeah.
Yeah, no, choosing that community is so important, and also knowing where to go for resources for help. So, for those, one of the saddest part of, and why is this so important, right? Why are we having this conversation today? We're having this conversation because, for example, one of the consequence of untreated depression is suicide,
Mm.
or just of depression in general is the potential for suicide. And we know that shockingly, suicide is one of the leading causes of postpartum death.
Mm.
One of the leading causes of postpartum death is suicide, and we don't talk about it.
At
And
all.
what's interested in, when there was a study that looked at the breakdown of the women who committed suicide, there was evidence that there was opportunity in 51% to make change, to change the outcome. So we're having this conversation today because we want to save that mom from being the next suicide victim. We want to make sure that our women are able to have the resources that they need to make the changes that they need, whether it's through therapy, and you may want to go to a practitioner that looks like you. So you may want to tap on therapy for Black girls, or right here with Sushana, looking and making sure we have these networks and these access, right? And then also making sure that you have that suicide number at hand. The new hotline, made easy, 988. If you are in trouble, need help immediately, three numbers to dial, 988. And
Mhm.
then when you may be wondering, well, where do I also get access to, if you're calling from around, Shoshana can't help all of y'all. Okay. She can help a lot of y'all, but not all of y'all. There's just not enough therapists out there that look like us, just like there's not enough OBGYNs that look like us. So sometimes we have to tap into other resources like the postpartum, like PSI, Postpartum Support International. They've been around. I consider them to be the gurus in this particular area, because they've been around for so long and have just great trainings that we all participate in, myself included. I do not pretend to be the solution to this macro problem. And I love the fact that we can gather together and combine our resources for our community. And then
Yeah.
also if you're in the Los Angeles County area, tapping into ooh, brain freeze, mental health. I'm gonna correct this if I'm saying the name wrong, but I believe it's mental health for moms. Hold up. Mental, no, see, here we go. Maternal mental health now. Lord, you guys, we have a lot of acronyms out there. So,
Okay.
so forgive me, but Maternal Mental Health Now is a great resource in the Los Angeles County area. And then also I'm tapping into, I'm trying to think if I'm missing someone else. But those are the ones that kind of come to my immediate mind. And those are also resources included here on this platform that can lead you to additional resources like support groups, like mom groups that are very popular. There's so many mom groups that I follow on social media. So I love the birth, no pun intended, but the birth of all these support areas. And then also, at the end of it, deciding whether or not you want to have therapy, or whether you need therapy with medication, and having a conversation about that.
And
Should
not
I be
being
on
afraid of that
medication?
conversation, right?
Huh?
And not being afraid of that conversation.
Not at all. And I'm about to say something that may make people very uncomfortable, but just about every psychiatric medication goes into the breast milk.
Mm.
That makes us uncomfortable, right? As soon as you hear that, you're like, oh my goodness, I can't take medication because it goes into the breast milk. So let's talk about that. So, what are some of the consequences of untreated mental health disorders? We know for some women therapy is enough. And a lot of women will do very well with therapy. Sometimes dealing with their even experience of that recent childbirth is sometimes the trigger for their mental health disorder. So working through those things with a therapist is excellent. We have some women, however, who have very severe symptoms, right? The ones that are more likely to encounter a psychosis or have really detrimental and disabling effect of their depression or their anxiety symptoms. I've had people who can't drive because of their symptoms, because they're so anxious that they stop driving. That's a change in their entire lifestyle, especially if you live in an area where you have to drive. That's a big deal.
Yeah.
right? And we have some women that completely isolate. They don't go out anymore. Their relationships are affected. Their partnerships are affected. Their productivity at work is affected. And oftentimes we don't talk about the children. Well, what are the outcome of the children? One of the things we're learning in a growing field in medicine is this perinatal programming. We know, sadly, a lot of the research came out of 9/11, and the traumatic experience of 9/11 for women who were pregnant at that time. And we know that in the offspring that we are seeing negative outcomes or outcomes as a result of traumatic experience or severe mental health experiences. This is why it's so important when you're thinking about taking care of your child and what's the best for your child. We want you to have the full picture of what you're choosing in between, right? So sometimes it makes you uncomfortable to know that medications do go into the breast milk, but we have not seen there are certain antidepressants we use that have been shown over years to be safe for children, right? To be safe, even if a small amount gets into the breast milk. And the ones we choose are the ones that usually have a very small amount that gets into the breast milk. But that
Mhm.
makes some people uncomfortable, which is why we're talking about it. If
Mhm.
you don't treat your mental health disorder, you may experience psychosis. This is when we hear those horrible stories of a mom that seemed okay one day according to everybody else, and
Yeah.
then the next day she harmed herself or her children. And sometimes it's not that severe, but she starts cutting, she starts self-harming or having others destructive behavior. These
And
are
what
all
impact is that gonna have on the child or the children, right? So, if you say it's your first child, "Oh, it's an infant," they don't see it, they don't know. But what if it's a 2-year-old? What if it's a 5-year-old? What if it's a 15-year-old? And then
right.
they're seeing everything. We know our kids listen and see and understand more than we think they do.
You're absolutely right. And also that in utero child, for those who have peripartum depression, anxiety disorders, that in utero child is seeing your stress hormones,
Yeah.
right? You may not talk about it, but your body tells everything. And whether or not we say it through our lips or through our emotions, we're still having those biochemical changes. And so we are seeing that babies born to moms with mental health conditions, especially if it's untreated, may have low APGAR scores. That's the well-being assessment of the baby at birth. Be more likely to be irritable, less likely to be self-soothing, more likely to have issues at birth. There's often bonding issues between mom and child if there's a mental health disorder that's untreated, and that can lead to developmental issues for the baby. We are seeing cognitive impairment. We're seeing an impact in the child's own emotional health. We're seeing impact in the child's mental health ability. So there are a multitude of consequences of untreated mental health that impacts the child. Even from in utero, their stress hormones are higher at birth, so there are consequences, and we want to make sure that that's known to people, that it's not just you not taking care of you, that you're the only person impacted by it. Your relationships are impacted, and your own child that you're trying to bring into the world healthy is also directly impacted by untreated mental health conditions.
Yes. And that's why it's so important to have conversations about this, right? So earlier you were speaking, and I thought this is why we need to have conversations with our family because a lot of times we feel alone. A lot of
Mhm.
times we feel like I'm the only one experiencing this. I'm the only one that feels this way. I'm the only one that's thinking like this. And when you have these conversations, you'll find out grandma felt like this, mommy felt like this, auntie felt like this, or uncle or daddy felt like this, right? That some family member has experienced some form of mental health challenges that impacted their lives, but they weren't talking about it 40 years ago. And when
No.
you bring it up, then you discover there's a similarity there, or even how you mentioned before, there are a lot of times where people will say, "Oh, she did seem sad. Oh, no,
Mhm,
she wasn't coming around the family as much." They're indicating symptoms and
mhm.
fires that we saw, and even
Mhm.
whispered about amongst family, but
Yes.
didn't bring it to the forefront, didn't have that conversation, wasn't, and to be honest, brave enough to say, "Hey, how are you?
Mhm.
What's going on? How can I support you? How can I help you in this area?"
Right. Right. And, in my own Caribbean culture, we sometimes create nicknames, right? Long mouth this person, which talks about the saggingness of the person. We create these playful nicknames, but really don't take the time to really explore what's going on in a person's life.
Yes. Yes.
Yeah.
That's a whole nother live. That's a whole nother live. The that, right, you mentioned some resources, and what I wanted to mention, there's a book called The Body Keeps the Score, which is a powerful book, and then there's one that was recently released called Emotional Inheritance. It talks about
Ooh.
intergenerational trauma, and there's so much that we already know, right? We kind of know. So I was talking to my kids the other day, and we were
Mhm,
in a car accident a few years ago, and the airbags hit my legs, and I had bruises for about a year. Well, it's
mhm.
been about 5 years now, but if my kids lean on me a certain way, I still feel that pain in that same area, and we don't realize that the body truly keeps the score, whether it's physically, mentally, emotionally, our body remembers, and when stressful things happen, when traumatizing things happen, the pain is then triggered, right? And do we
Yes.
have the capacity to deal with that pain? If I'm taking care of thank you, Lord, I didn't have this, but if I'm taking care of 3 kids under the age of 3, right? If I'm experiencing divorce, if I'm experiencing
Mhm,
dysfunction within my external family, so they don't live with me, but I don't have daddy support, I don't have mommy support, I don't have
mhm,
a relationship with whichever family member, that is then impacting my mental health, and so we
mhm.
have to be mindful of these things and even, like, willing to talk about these things so that we can get the support that we need. I know
Absolutely.
personally, my friend group, my church family has supported me beyond measure, and those are some people that I know that I can turn to. We caught COVID. I had my youngest daughter March of 2020,
Mhm,
and by the grace of God, we got to February of 2021, and then we caught COVID. And before
mhm,
I could even say anything, like, I think I sent a text that said, like, "Pray for us." There were people knocking on my door with medicine and food and, you know, Instacart coming to my door. Like, I didn't have to ask them. Like, I was in tears because
mhm.
I didn't ask, like, "Hey, can you guys send me some medicine?" They just knew. Like, several friends just came together and took care of me, right? And so
That's
even
so dope.
I still, like, they act as if it was no big deal, and I'm still like, I didn't have to ask. Not I asked and you did it. I didn't even have to ask, right? And so what we need to remember is even if we don't have it from, say, mommy, daddy, grandma, grandpa,
Mhm, mhm.
make sure that you have people surrounding you and supporting you that you can be honest with in your time of need. So when there are mental health challenges, you can be honest with them. Hopefully with your family, right? Hopefully you can have
Right,
conversations. But if not, there has to be someone in your life that you can have these conversations with. And if you don't even have the friends, then you find the right counselor.
right. Exactly. I love that. I always sometimes think about what would we all be like if we were nurtured in that environment throughout our entire life. I mean, we my mind blows to think of how whole we would be as human beings. But I think that's beautiful, and that should be the norm. That's the norm we're trying to create. And I love the fact that you shared that not all of us have those familiar relationships. Sometimes we're estranged, sometimes, for circumstances that beyond our control. And so it's about sometimes tapping into these resources like this platform
Yeah,
that can be your surrogate family,
yeah,
that can be your surrogate community.
yes. And also an opportunity to teach you what community should look like.
Exactly. Exactly.
Um,
Oh my gosh. Ooh, child. There are so many thoughts going through my head based on
I
that.
I'm literally sitting here writing notes, and then I'm even, like, skipping over some of the notes to, like, touch on something else because I think and we know as Black women, because we do so much, because so much is put on our shoulders, because we are encouraged to hold on to our emotions, right? We can't be
Mhm,
angry and we can't be sad.
mhm.
All the things, right? Or sometimes even too happy, right? Why are you smiling? But if we have conversations with each other, if we're honest with each other, even allowing your friends to be sad with you, right? Something I've noticed, you speak to someone and you say like, "Hey, Taska, how are
Mhm.
you doing?" And the person responds, "How are you doing?" But you didn't
Yeah.
answer me. You didn't tell me how you're doing. And
Mhm.
a lot of the time it's, "Oh, I'm okay. I'm fine," or, "I'm
I'm
blessed."
good. I'm good.
But are you
Yeah.
really?
Yeah.
And sometimes people don't really wanna hear the real answer, right? But there's an if there should be enough people in your life that wanna hear the real answer. So if
I
you're
love that.
doing amazing and you're doing really well, share.
Mhm.
If you're having a hard time and you're struggling, share.
Mhm.
I've found that you never know when someone is feeling similar and you can encourage one another. Sometimes
That's
it's
true.
gonna be that you're the strong friend, sometimes it's gonna be that you're the weak friend, but oftentimes when you speak to true friends, right, people that are trusted and tried
Mhm.
and true,
Mhm.
oftentimes you'll find that the person has experienced something similar or can understand or has witnessed something similar and can encourage you, and
Mhm.
vice versa. And sometimes you can encourage yourself as you encourage others.
Yeah, yeah, absolutely, absolutely. You find strength in that, in sharpening somebody else just the same. And I,
Mhm.
I love the fact that you shared also just historically where this idea of being a strong Black woman comes from. And it's important for us to know that it was a form of survival. Like our grandparents and parents after that, before that, our family members, our lineage had to survive.
Yeah.
They didn't have the opportunities to live to the fullness of what we experience today. I'm not saying that we don't have our own struggles of our times, because we all know we do. But they were literally in survival mode, and strength was necessary
Mhm.
to survive, to literally survive from day to day.
Yeah.
Now we are in a time frame where we can expose our weak moments. And knowing that having a weak moment does not deter or does not change your strength. So I am a strong Black woman whether I'm in tears or whether I am joyful.
Yeah.
My strength doesn't come from my emotions or my experiences. My strength comes from my resilience, my ability to endure. And so I may have a weak experience, and that's okay. And being able to have the people, the individuals in your life that and invest in people. That's my new thing this year. I don't know where that's coming from, but my new thought is spending more time investing in people. And investing doesn't mean financially, but investing time, investing support, investing compassion in people more than we invest on the stock market and in other places of our lives.
And Taska, what happens when you invest? There's a return, right? And there's loss and there's gain, right?
Mhm.
But
Yes,
but when you stick it out, when you don't give up, and when you invest wisely, there's a return.
absolutely, absolutely, and those are the returns that you can't pay for.
Yeah, yeah. Oh, my goodness. Yes. We have other topics.
I'm sorry, I'm sorry.
No, it's good. It's good because we have to have these conversations, and it's the reality that any and everything that we face in life can impact us, right?
Yes.
A lot of times we think our mental health will only be affected if we experience something traumatic. We're not acknowledging the reality of stress, right? How many of us,
Mhm.
the past 3 years, the past
Alone.
3 years have been stressful. And right now in
Yeah.
2023, a lot of people are acting like the past 3 years didn't happen. And so
Mhm.
we're expected to go back to normal, right?
Mhm.
But the past 3 years, so many people have just had to accept what was going on, right? So even if you didn't lose anyone, even if no one
Mhm.
knew you experienced anything traumatic, you still lived through this. And let's not right now talk about racial trauma, right? So
Mhm. Mhm.
it being highlighted, like we knew 10 years ago, 20 years ago, 30 years ago, we knew what was going on. It wasn't news to us, but it now being highlighted and highlighted across all social media. So not just the news, but
Mhm.
every time you go into Instagram, every time you go on Facebook, every time
Yes.
you go onto these other platforms, the things that are happening are being highlighted and you're being reminded, right?
Yeah.
Biases and prejudice is being exposed, at whatever place of business you want to go visit or at
Mhm.
workplace. Being exposed to that on a continuous basis is
Mhm.
stressful. It will impact you
Mhm.
mentally. So it's
Mhm.
not, I got into a car accident or I ended up having a C-section or, I lost a family member or a parent. It's the daily stressors of work, right?
Yes. Mhm.
Relating with others, trying to get ourselves together, right?
Life.
Just all of those impact our mental health and can trigger things that we need to be able to recognize and address and face and find support for.
Yes.
Conversations like this are vital to the recognition that it just doesn't have to be a traumatic event.
Mhm. 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 You're absolutely, absolutely right. Life happens, right? And sometimes just especially as communities of color, because life happens to us in a way that's stressful on so many different aspects of our living, from where we live in our communities, from disparities in our jobs to disparities in how, being able to get healthy food, just every aspect of our life, we're encountering some level of stressor. So our experiences, or what would be common as just life, is more stressful for us than someone who is white, in specifically in the US. And so it's important to not belittle those experiences or our response to those experiences, our relationship breakups, having a new baby unexpectedly, now having to deal with the finances of that, or dealing with the demands of that, delay in our careers, whatever the life issue is really important. The other thing I want to make sure that we mention also is the other reason why it's important to disclose depression like symptoms or concern for depression is because it may not be a mental health disorder. So there are there are secondary conditions or medical conditions that can mimic depression. And some of them are nutritional based, like low vitamin D levels have been linked to low energy levels, thyroid dysfunction, which is very common in women and more common to have thyroid disease in women, especially around or at the time of pregnancy because of all the biochemical changes and the immune changes during pregnancy. So making sure that our thyroid is checked, making sure that there is no other secondary cause that can be resulting in our depressed mood that really can truly impact our health, and making sure that those issues aren't missed because those are big deals. So we definitely want to make sure that people are aware that there are medical conditions that can also result in similar symptoms as depression, and that if they are not treated can lead to really adverse outcomes in our health.
Taska, thank you, because I meant to talk about that. When you were talking about medication, right?
Hmm.
We eat every day. There's some things that are not great for us, but we still eat, right?
Hmm. Hmm.
We drink every day. We know
Hmm.
we're supposed to be drinking water, but we'll drink that Coke, we'll drink that Sprite, and we don't think twice about it, right? Or
Right.
even
Right.
even certain things they're like, "Don't eat raw fish, don't eat this," be
Hmm.
mindful during pregnancy, and you still take that chance. But then
Hmm. And
medication,
we see y'all.
I'm guilty, I'm guilty. That
Uh-huh.
medication that can be beneficial and helpful, right?
Mhm.
That can balance out your hormones, that can prevent certain disorders from becoming worse or manifesting in dramatic ways, but we don't talk about that. We don't look at it that way. We overlook,
Mhm.
stay away from fast food, XYZ, stay away from alcohol, right?
Mhm.
How many
Mhm.
people are like, "Oh, I'm a pump and dump."
Yes. A lot.
You don't take a chance with that alcohol,
Mhm.
or you're not gonna take this chance with this medication. That research has been done on this to say, "Okay, this is the
Yeah.
safest option," right?
Yeah.
And I have been in mommy groups where people have talked about it and just been like, I'm apprehensive about getting pregnant because of this, or I'm apprehensive now that
Mhm.
I am pregnant. And all the time we're like, keep taking your meds and keep talking to your doctor. Like,
Right.
it's fine to
Right.
feel apprehensive. It's fine to have questions.
Mhm.
Have to continue to do what's best in this time so that, nothing catastrophic happens.
Mhm.
And I was also gonna, in that, say, like, we have to pay attention to what we're taking in, right?
Mhm.
Have to make sure that we're getting enough nutrition, we're getting enough protein, um,
Please.
whether it's vegan protein or otherwise.
Mhm.
Making
Mhm.
sure we're getting enough healthy fat, right?
Mhm. Mhm.
Me with my first, there's a diet called the Brewster's diet, which is protein heavy, and I
Mhm.
honestly believe that in everybody's different, right?
Mhm. Mhm.
For me, I needed that extra protein, and it helped me to stay healthy, even though I was overweight. I believe that really bolstered my body and what I was able to do for all three of my pregnancies. Just making and that's the difficulty, right? In many of our communities, we don't have quality vegetables, produce,
No.
what have you, or even if we don't have enough resources financially to
Mhm.
get enough food, right? And so
Mhm. Mhm.
it's being able to pay attention to what we're putting in our body, moving, making sure that we are taking a walk at the least, if not going swimming or doing yoga or Pilates or something.
Yes. Yes, which also helps your mental health. Specifically, yoga is really good for anxiety disorders, exercising, even postpartum. And we're not expecting moms to go lift 300 pounds in the gym immediately postpartum, but you can go for a walk. That cabin fever is real. And didn't we all learn about this through pandemic? Like, I don't understand how we don't have the most compassion for moms after what we experienced during the pandemic, because the pandemic in so many ways
Yeah,
mimicked what motherhood is and
yeah.
some of the challenges of motherhood.
Mhm.
And one of the thing was being inside all that time really impacted and disclosed or revealed a lot of people's undisclosed mental health or previously unknown mental health conditions, and became a trigger for a multitude of reasons. But
Yeah.
that cabin fever, when moms are in with their newborns 24/7, 7 days a week, exhausted. So, exhaustion, hormonal changes, lack of sleep, sometimes a cranky baby, sometimes a cranky partner. And we're expected to be completely normal. It's very difficult. So, I always tell my patients, especially as a part of our treatment plan. And I love that you're going over this. The nutrition is hugely important. Like we talk about this. If we're going to treat your mental health, we have to treat it from all aspects. We're recruiting people to help you so you can sleep. When your husband comes home and he has, if he's working dad and he has the weekend off, guess what? One of those days he gets to see what it's like to be you. You go take a nap, he's up with the kids. The next day, he gets his day, right? Being able to have those kind of conversation and planning those things even before the pregnancy, and then getting outside for even a few moments and getting that sun exposure is so important and so undervalued in that postpartum period. Even if your husband comes home.
I was gonna mention that I recently learned something about serotonin, and the recommendation was even before you turn on your cell phone, go to your window. If you can't get outside, go to your window and allow your eyes to take in the sunlight for at least 10 minutes before you do anything else.
Oh, I love that. I'm going to do that this week. I'm going to try that this week. I love that. First of all, we shouldn't be turning on our phones,
Girl,
period. That's a whole
but
other.
now, because back in the day, we used to have to turn on the computer and wait for it to boot up, and now it's just phone in the hand, phone
Yes.
in the nightstand.
And some of folks fell asleep with the phone in their hand and woke up and the phone is
I
still
know
in
those
their
people.
hand.
I know those people. I'm talking about my husband.
There are plenty in that tribe, okay?
Yeah.
I love that. I love that idea. Like, and I also include in my patients when we talk about exercise, when they do exercise and they're having some mental health challenges, to connect with nature.
Mhm.
There's something really powerful about connecting with nature that boosts your mental health. and your mental wellness. So if you can safely go for a nature walk, it doesn't have to be far. It doesn't have, if you have a local especially if we live in metropolis situations where we may not necessarily have access to greenery. It doesn't have to be a lot of greenery. You can go to your local botanic gardens, your local, um, uh, whatever cafe spaces that have a little bit of greenery. But there is something really powerful about being connected with nature. And for me, I think it's also part of connecting with your creator, if you believe in a higher power, that I think really helps to boost someone's mental wellness.
Mm. So, just side topic that we're getting into, but just talk to me a little bit. What is meditation exactly?
So meditation, the practice of meditation varies for different people, right? So it can be as simple as having a mindful breathing activity during the middle of a stressful day. And I'm saying this because my own doctor said, "Girl, you need a mindful minute." And I was like, "Girl, you are right."
My
So
kids tell me that all the time. They learn it in school, and they're like, "Mommy, I think you need to take a couple deep breaths."
yes, and it's really just being so connected and present with yourself. And that looks, people practice different types of meditative practices. Some people do more spiritual meditative practices. Some people more focus on just the traditional breathing exercises and self-awareness. Some people do it for a half an hour, other people do it for a minute, like myself, because we don't have a half an hour of downtime. But whatever it takes to reconnect you and bring you back presently. And meditative and mindful activities, just to mention, there was a recent study that came out that said that they are as helpful as medical therapy. And so they're not to be excluded as an option for people who may not necessarily, for specifically anxiety disorders. And so for women who are suffering from anxiety or challenged with anxiety disorder, I'm trying to be very mindful of my words, who are
Yeah.
challenged with anxiety disorder, using mindful activities, if you're not interested in medication, may be a sufficient alternative or a viable alternative for you. So those practices, do not ignore them as an alternative if you're really resilient or against or adverse to medical therapy. If you have severe symptoms, medical therapy would not be necessary for you, regardless.
Completely understand. And I just want to reiterate that, right? Like there are so many ways that can help us relieve stress, right? Whether
Mhm.
it's talking with someone, professional therapy, or a friend, family member, taking a walk, preferably a walk in nature, taking in some sunlight earlier in the day. If not early in the day, still taking a walk at night so that your body can be moving, your heart can be pumping, you're getting some fresh air, but also, um, taking a moment to just center yourself, right? I think as a believer, you hear meditation and you can run off with all the thoughts, but it's simply being able to take some time for yourself, being able to quiet yourself and center yourself, whether you're spending time in prayer, whether you're spending time affirming yourself, right? Even like positive affirmations, like speaking life to yourself. There are so many ways that we can help relieve stress in the
Mhm.
process of getting other types of help.
Yeah, yeah, very important. And these things, and can we talk about the fact that you don't have to have a health disorder to wait till you actually have the disorder to practice these behaviors and these lifestyle changes. So one of your planning, and kudos to the women out there who are planning their pregnancies. Okay, I see y'all. I love y'all, because that's how we have even better outcomes, is being really intentional. So kudos to your friend also, who is mindful of her mental health and really thinking before she gets pregnant about what her plan would be with medications or not. Just the even planning process is key and important in improving outcomes.
Yeah.
But if you are especially or have a risk factor for mental health disorder, going ahead and including all these activities preemptively is so critical and so important. And we know that Black women, that the studies have shown that the underlying issue with our adverse outcomes with maternal health has to do with racism, which, i.e., the impact of stress daily on our lives. So We should, just like we shouldn't be adding any salt to anything that we eat, we should always be in a lifestyle of de-stressing. And that's actually a question I asked my patient at our first visit. On a scale of 0 to 10, how stressful is life to you?
Wow.
Because stress is something that's perceptive, right? So some people may live exactly the same life conditions, but their interpretation of it and the effect of it may differ. So I actually screen for stress.
So powerful. So powerful. So important to pay attention, right? To
Mhm,
consider it, because a lot of times when we are experiencing stress, we're not aware of it. We're not acknowledging it. We're just kind of pushing through, and it is sometimes where your partner or spouse might say, "You're doing too much." A friend, even sometimes an employer might, You're doing a lot. You got a lot on your plate. You got a lot on your shoulders." And then,
mhm, mhm,
wait, I am doing a lot. Even
mhm,
through the pandemic, recognizing, right, we didn't have as many appointments and, you know, activities. We
mhm,
we didn't have to say no to the birthday party, the brunch, the dinner, the family gathering. We got a chance to slow down.
mhm.
Now we're jumping back into all the activities and all the things, and that can be stressful.
Yes,
And so
yes,
being able to recognize that and allow ourselves an opportunity to say, okay, slow down. Let's consider
yes,
what we need to do versus what we want to do.
yes, yes.
What's going to be beneficial.
I'm actually thinking of a patient in my head who's having that exact issue. Mhm. It's very real. Yeah.
Taska, we're gonna have to do this again.
I was like, "Oh, we didn't even touch on the dads and their depression, but we could do that another time."
And we need to talk about that, because even though I know that, right? Like we have
Mhm,
clients, you don't connect it to childbirth. You don't talk about what dads go through, right? So I did a workshop recently,
mhm,
where we talked about pregnancy and death, right? So if you lost a child um, early on or at full term or after delivering, and something that they pointed out was how dads responded to the passing, right? And a lot of times,
yes.
not trying to dive in, but a lot of times the mom seems devastated, right? The mom is crying, the mom is mourning, and the
Mhm,
dad may seem detached. But the reality is, no one's asking them how they're doing. No one's checking
right.
in on them. No one's asking them how they feel. No one's asking them what they need or what they want. And who thinks of that? Like, I had not, and they were in particular talking about like having a miscarriage, right? A lot
Mhm,
of times it seems like the dad is not responsive, doesn't show any emotion. And a couple dads shared with the workshop presenter, like, I want to be mindful of my partner. Like, my partner was carrying the child. And
mhm,
then on
mhm,
top of me trying to be mindful, how do I show my grief? How do I then let it all out while I'm trying to be strong for my partner?
mhm.
Like,
It's very real.
never considered it. It
It's
happened
very
for
real.
I had 2 early losses,
Mhm,
and my husband is not really a crier. I'm a crier, I'm emotional,
mhm,
and we had conversations, right? But I never thought to myself, like, his outward response, he could still be feeling the extreme of what I'm feeling. It's
mhm.
just not showing outwardly. Like, I never thought of it before.
Yeah, their grief is oftentimes, especially Black men, is expressed differently, and sometimes it can be expressed as a short fuse or detachment, or it's very, very subtle.
Yeah.
Um, and so it's really important for us to be able to know those signs and have these open forums for men. We know that men are more likely to have peripartum depression if the partner is experiencing peripartum depression as well. We know the prevalence of depression symptoms is 4% in fathers.
Mhm.
Um, and I personally think that's an underestimate because we're so not good at diagnosing it in dads, but that's what we know as of now. So it's definitely a real conversation to have. And grieving loss is very real for the dad, and oftentimes they feel guilt with paying attention to their grief because they feel like their attention should be focused on the mom. So we
Yeah.
definitely need to have a conversation about that. It's a very real issue.
Yes. And just Black men dealing with depression and how it presents. because,
Yeah.
as you said, it presents differently than what
Mhm.
is commonly talked about, and it happens with us as well. It presents
Yes.
differently, and it's perceived as one thing when it's truly you're dealing with depression, you're dealing with anxiety, you're dealing with certain, mental
Yeah.
health challenges.
I also wanna encourage people to cry. I know we don't feel comfortable crying, but we need to normalize crying.
Yes.
I think I say this often. I think the human body is so remarkably made, and we need not overlook any function, natural function of the body. Crying is so not only empowering to be able to be that vulnerable, but also there are physiological benefits of crying.
It's
So
a
if
release.
yes, it is an absolute release. It's an emotional and physiological release. It helps to restabilize those stress hormones. So let's make spaces where people feel safe to cry.
I agree. And think about it, Taska. There are times when we cry for joy, and there are
Hmm.
times when we cry for sadness, and there are times when we cry because we're angry.
Yes, yes, yes. And
Like,
all of those are okay.
yes, and it's a way that our body functions. We've
Hmm.
all experienced it on some level, even if you're holding back the tears. There are
Yes,
times that you've been laughing so hard that tears come to your eyes.
yes, yes.
There have been times that I know I have been angry and I'm holding back the anger and I
Oh,
can't.
yes. Yes. Yes, I can relate.
That's a very good point. We do need to do that more, and it's like you said, it's a place of vulnerability as well.
Mhm.
Mm. Oh my goodness, Taska, we talked about so much. I do want to share. Um,
Uh-huh.
there are resources on our website, so simplyredefining.com. We're also going to put together all the resources that all of our experts have shared. So you guys make sure and tap in. Tasca, I want you to share how people can keep in touch with you, follow you, continue to get information from you.
Awesome. So I am Dr. T, and I call myself the hand behind the handle of healthybump.club. You can follow us on Instagram as healthybump.club, and you can follow us on YouTube as Healthy Bump Club. So you will find, what will you find? So you will find a library of resources. We talk about a lot of topics, from topics that people are uncomfortable talking about. We get real, and we try to remove the barriers and create a safe space for moms and those who are interested in becoming a mother of all kinds. So we talk about every topic from surrogacy to preeclampsia, and we talk about it specifically through the lens as women of color because our experiences are so different. And we are trying to educate not just the public, but also our own professions about how we are different and how we present differently and ways that they should approach us differently. Not with equity. So, not differently with disparity, but differently with equity, to make that clear.
Yeah.
What you can also gain from us, if you are interested and you have a condition, you're not where we consider ourselves to be educators. We try to keep updated with the latest research and latest stats and all those things. That's what we just enjoy doing. So if you have a condition and you feel like my provider doesn't seem to have the time to really spend to really educate me on this, I want someone to really walk me through this. We are available for that, and you can go to our link tree on our Instagram, and that will lead you to the option of selecting one of us to discuss a topic, or we call a second opinion. We're not treating your condition, we're just helping you understand and be empowered in your condition. And so that's what we do.
So I want you to restate how they can find you, and then also tell us some of the professionals that work with Healthy Bum Club.
Oh, awesome. So you can find us on Instagram at healthybump.club, or you can find us at YouTube where you can view our library of resources. You can also on Instagram, you can click on our link tree, which would lead to just a list of our resources as well. So on our platform, oh my goodness, who hasn't been on our panel? We have such, well, I know who hasn't been on our panel, but we're going to work on her coming on a panel. Okay. Um, But we are so immensely blessed to have a physical therapist, a doctor in psychology, to have a variety of mental health practitioners, from our perinatal mental health practitioners to our LCSWs, to name it, we've had it. We have our nutritionists that come on our panel. We have our midwives. We have our doulas. You guys name it. We have a urologist who's coming on our panel. Okay. Like,
Ooh.
name it. We've had it. And guess what? You get to see the 2%. We've had pediatricians, both Latina, Black, Caribbean, American, Black, African. Y'all, we have everybody coming on the panel. What's so beautiful is that you get to see these gorgeous hues on our platform,
It's
all different
impressive.
history,
So
all
impressive.
and listen, and in many of our fields, we are the 2 to at most 5%ers. So we are the rarity, and on Healthy Bump Club, you get to see us and you get to hear from us.
Yeah.
Real.
And receive that knowledge, receive that education, receive that support.
Amen.
Yes. Because I feel like I've learned so much from watching the videos, and I haven't even watched all of them. So I co-sign.
Oh,
Check.
thank you for watching. And we are in edutainment, because we have some interesting person. You know, as women of color, we are colorful,
I have, I
not
have,
just in our hues, but in our personalities. So you will really enjoy those videos.
yes, yes, yes. Well, Task, I want to say thank you so much for joining us. This is literally the first, not the last. I am so thankful for you, and I appreciate you beyond words.
Thank you for having me. This has been a pleasure. I love having these real conversations, man. We go there, and I'm about to do exactly what you said: open the blinds and get my son first thing in the morning.
Yes, good, good,
My
good.
son and my son.
Girl. Yes. All right. Have a great afternoon. Thank you for joining us. We will speak with you soon. Be sure to feel free to reach out to simplyredefining.com. We're on Facebook, Instagram, YouTube as well. And Dr. T, just rewind a little bit and you can hear her information to connect with her. Right? You guys have a great day.
Awesome.